Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to just basically have a free-for-all, ask me anything kind of format here tonight because I had a lot of cool cases today and there was a lot going on and I feel like just talking about that mostly. So I'll wait a few more moments for more people to join us here. And we'll kind of just go through just a little bit about how we do acne or scars and pigmentation. I had a patient today. He had done 7 sessions of Subcision. He got that done over at multiple different providers, and he didn't really think that he needed to do it again per se. He thought maybe he just needed fat transfer, but then he ended up going to a plastic surgeon who saw that he still had tethered scars and appropriately saw that he needed more subcision. And so then he reached out to me because he was really frustrated with the fact that he's done so much subcision before and nothing was really working for him. So I ended up doing it. He came all the way over from Santa Cruz, California, and drove 6 hours, he said, to come down, and there was so much scar tissue in there. He also had gotten some filler, actually. He got some filler done at the same time, or I should say afterwards. He had done the subcision before, and the filler had caused this donut process around the scar tissue, and there was these lumps all along over there. So a lot of people think that you could just do filler for scars, and that's all you have to do. You don't have to do subcision. But what could end up happening, especially when there's these thick scars like that, it can really actually be very difficult to place the filler in the right spot. And what ends up happening is actually a lot of patients, they get filler and then they notice that maybe initially it was okay, but over time it ended up getting something where it caused the filler to go around the scars and it could look really, really odd or unnatural. Or just, of course, didn't even solve anything right there. Big Dog, good seeing you on, Big Dog. I haven't seen you on actually. Let's see here. Are lasers worth it? Have scars post-Accutane decently bad? There's a few different things that we need a lot of times. It's not necessary for us to always do laser, but for some cases, yes, laser could be really, really great. It just depends on how much scar tissue there is and what's required for resurfacing itself. Z Cosmo saying, what's the average price for full face CO2 laser resurfacing? Are you talking about for like anti-aging purposes or for scars? Scars, it's really different. I usually don't do full face for that. And so it just depends on if you're talking about for like just like you're someone who's elderly, a lot of deep lines and wrinkles, and you want me to resurface that, then yes, that would be like full face resurfacing. And I believe our prices for that are also available on our page at drqazi.com, so you can go ahead and see that over there. Good seeing you on, guys. Good, appreciate everybody. Thank you for the kind words. So let's see here. Strawberry Banana saying, thoughts on Clear and Brilliant for ice pick scars. It's not going to be great at all for that. Really, really not going to be helpful for ice pick scars. It's more really designed actually for a little bit of superficial pigmentation, a little light resurfacing, but not going to do much at all for scars. I wouldn't recommend that at all for scars. Can you show somebody who is a Fitzpatrick 6 patient? Yes, give me a few moments. I'll try to find someone. And, I could show a case that we did where you could see actually in this particular case, we didn't end up doing any lasers in this case, actually. So I'll show you actually this particular case. This is a good case. I've shown him before, but he's somebody we worked on a few different times. And you can see that improvement over here for his scars. So take a look and see this gentleman here. Really nice gentleman, comes all the way from New Orleans. You can see for him, we actually did Subcision. We also did TCA Cross, and I did Bellafill for him. And you can see, look at that improvement here for his skin. So yes, we absolutely can do, it's not necessary that we do lasers in all skin types, but it's not necessary all the time. Sometimes there's patients like this who don't really have as much volume, they don't have as much of a texture issue. They have more of a volume issue. And so we had to break up that scar tissue, and then we ended up actually placing a little bit of Bellafill in there, and that ended up working really well for the patient. So that's what I would recommend actually for a lot of patients that are, unsure what they need, and they're told to do something like this, like Strawberry Banana saying Clear and Brilliant. And it's like, just come on here and I'll tell you if that's something that's going to help you out, because a lot of times it doesn't. Clear and Brilliant's not going to help out for scars. it's certainly not going to do enough for it. And there's people who have done 10, 20 sessions sometimes, and they were told that was going to help their scars, and it ended up making things, just like more pigmented, and or just didn't do anything for it, so which isn't helpful at all. Do you use Bellafill for chin augmentation? Yeah, it's awesome in the chin. Actually, it's awesome because it's a more permanent product. It's going to stay there, so you don't actually have to worry too much about like the volume loss going down there. And then it makes your skin quality itself better. So that's really, really nice also. How do I deal with people out of state? I deal with them really, really well, because when we have it, we have a whole process where first we have a consultation over usually Zoom. I'll go through your particular scars, circle them. Sometimes on the video call, I'll have you smile, test some things with lighting. And then when you come in, it's not a surprise. We do the treatment. You could go the same day if you want, or if it's a phenol peel, maybe probably about a week or so afterwards. But then after that, you're free to go, and we're able to manage this remotely. That being said, most of our patients, when they do come from out of state, and what we have them do is we have them, after we do a laser or subcision, anything like that, we have them send photos really for about a week or two, and then we're taking a look constantly to see what's happening with their skin, making sure that's really safe for them. I don't know of any other practice that really does that, and we will just keep on adjusting things really so that it continues to be safe, and you don't really have to worry about anything as we're doing these treatments. So that's typically what I end up doing, actually. Let's see if I can fix something here. It looks like people couldn't see the result properly, so hopefully you can see it a little bit better here. Is Bellafill a 5-year filler or permanent? So basically what happened is that they did the study for 5 years, and then they just stopped it after that. And, there's a lot of patients that will really have Bellafill, or what was called Ardfill before in the past, and it's still there. It's still visible over there. It hasn't gotten absorbed. And so the PMMA, there's no real evidence that it gets fully absorbed in the system. So it really is more likely of a permanent product. And that doesn't get, that PMMA doesn't get fully absorbed by your body. There's no real way of breaking it down. So that's good, actually. You want something underneath the scar tissue to stay there and just continue to remodel and restructure the skin. And then your own body makes collagen around it, which is useful too. Kofi is saying, hi, Dr. Qazi. How clear should I get my skin before starting to attack scars? I like that, attack scars. That's a good way of saying it. I'm still getting occasional breakouts. Occasional breakouts here and there are probably okay. But what we want to make sure is that the oil production is under control. There's not too much with the cystic acne. And, just here and there a little bit, it's okay. But we do want to get it really well controlled. We want to make sure that you're not going to get cystic acne afterwards. It's not something we're going to be particularly concerned about. Let's see. Shiraz John is saying, hi, Dr. Qazi. I recently got Bellafill the first time, but the Bellafill disappeared within 5 days, and my old volume for my scars reappeared. Why is that? Do I need more for my volume depression? You likely need more, but it's unclear to me if you got subcision beforehand, because that's what I was talking about earlier. You definitely need to do subcision before you do anything like this. For example, for this patient, we did subcision before we did filler, and so you definitely need to do that. And the patient that came in today from Santa Cruz, he drove all the way down here. He did subcision 6 or 7 times, and there was still so much scar tissue in there. He was shocked. He's like, are you really sure that we have to do this? And yeah, we had to. There was so much scar tissue in there. There was so much scar tissue. And actually, sometimes he comes on over here, and I may be on here actually right now. But yeah, there's a whole process involved with this. We got to break up that scar tissue. And Bellafill is a very, very soft product, so you may just need more. You may just like that a little bit of that volume, but you need more. Let's see here. Imi Eat World, good seeing you on. Let's see here. Telepuzik is saying, hi, Dr. Qazi. Do you practice doing many TCA Cross sessions for ice pick scars for people out of state? You mostly do a couple of big sessions for those people. Well, it depends. Sometimes it does take multiple sessions, but if we're able to excise scars, it could be faster. Sometimes ice pick scars also need subcision to break up that scar tissue, especially if there's a high concentration in a small area. You still sometimes need to go underneath that scar tissue and break it up really well. Sometimes it requires laser. It depends on your skin tone too. So it's not necessarily about the fact that you're out of state, but yes, I will try to pay attention to that and do as many things that we possibly can safely in that single session there. Shiraz is saying that the Bellafill didn't last, that they got subcision 1 month ago along with CO2 ablative fractional laser. So that's what, you may just need more Bellafill. The other possibility is that it really is possible that they just didn't do effective subcision. Like I said, the patient today did 6 or 7 subcision sessions before he came to me, and he had so much scar tissue. I had to break up all that scar tissue. That was the only way that we were able to get this so that we could do filler in the future. I had to break it up. It took all that a single session right there. It's going to be awesome eventually, but first step was really that subcision, which he never did. He did so much filler, and they never did proper, real, thorough subcision for him. So poor gentleman, I've done so much, suffered for so many times, so much with like these invasive procedures, suffered from acne, suffered from scars, suffered from doing the procedures multiple times, suffered from the lack of results in the procedure. So I just had to make sure it was just like going to be a killer result, and it's going to be awesome. PRP and CO2 fractional laser, is it effective for deep acne scars? Not so much, no. That's not going to help out too much. The PRP may help a bit with the downtime and the recovery, but not going to help so much for the scars though. And the reason why is that it's what it is basically platelet-rich plasma is full of growth factors, growth nutrients, and it gives some new blood flow over to the area. So the thought process is that microvascular circulation could potentially help out with scar recovery, things like that. It's just like that's the concept, really, because when you do scars, when you do anything with like any wound healing, you really want a good proliferation of the microvascular. You want to make sure that the blood flow is really excellent there. But the problem is that it wasn't really showcasing it when you're applying it topically to give us much of that improvement. And injecting it, whether it was doing it, I did that as well. It didn't really seem to change really at all for scars. So I never really used it for that. But it does seem to help with the recovery process. It does help with the recovery process, so I still could do that. But I never offer it for scar treatments itself. Unless there's something that would change one day that we need to do some additives that maybe improve it a little bit. But I'm not going to like experiment on patients and have it done that way, because I tried it many times and I never found it to be too effective actually for scars. I saw a patient today. He had actually, a poor gentleman, he was calling from Denver. He's going to come to me next month or so. And what ended up happening is that he was doing a whole bunch of treatments, but especially he was doing microneedling sessions. And he said the physician was taking photos of it right after he did the microneedling session and was showing everybody that this was the result. He did the procedure, and then immediately after the microneedling session, they took these photos. Actually, at some point, I think he's going to let me share those photos, because it's wild, actually, when you actually look at it, that he had so much swelling, and it was like due to the microneedling, and they were like acting like this is like how your scars are going to look. There's just like, it's really unfortunate. So you see these things, if you're looking at people and they're showing, that they could improve your scars with microneedling, apparently you have to ask when they did the photos. I guess that's something you should really be asking, because it turns out this patient who was going to a dermatologist to get this done, that derm was using these like photos from just immediately afterwards, immediately after doing microneedling. I mean, I can't even imagine, if I ended up doing like photos from Subcision, of course it'll be looking just completely smooth. We showcase anything like that where it's like there's swelling like that, it's going to look really smooth. So it's of course like that, and that's what these guys are doing. They're doing this all along. They're telling everybody to do microneedling and do this. And, you ask them for these photos, and the photos they're going to show you are like immediately afterwards. So that's really terrible. It's a really terrible thing, actually, that they set up, and they think that this is something that is okay to do to people. So again, one of my whole things here in life is that I'm going to actually just get this so that everybody who's in this world who has acne, who has scars, just could start understanding what is involved with this and how we can achieve really great results. There's a lot that's involved with it. There's a lot of really work that you have to do with making sure that you're good with sun exposure, really making sure that you're good about, eating clean, being healthy. But I will absolutely do my part of this job. I will absolutely do it, and it's just like always, I do it. And so it's like, here we go. We'll keep getting it there. And I'm never going to showcase a result like that where it's just like, oh, here's like a result from microneedling, right after we do microneedling session. That's just wild. And they pushed it on people. They pushed it and said it. What ethnicity is this client? This is a patient who's of African descent. So a melanated patient, Fitzpatrick 6. So this is a patient who really also didn't have much downtime, couldn't do much with recovery, but we were able to achieve a lot of different things right here because we ended up doing Subcision very effectively and doing some Bellafill TCA Cross worked really well. XG is saying, the other day you talked about a filler for acne scars, but I forgot the name, the one that lasts for several years. That's Bellafill. That's what I use a ton of. I use a lot of Bellafill, actually, because it works really well to always have some support underneath the scar. You have something there that's going to just stay there and provide some structure. It's awesome, actually. Kat is saying, Dr. Qazi, is it okay to use oil cleanser before Accure laser appointments, or is that too intense? So that's a good question, actually. You know, I do use an oil-based cleanser myself, actually, for shaving. It's actually awesome. I love it. But I'm not really as acne prone anymore, so it's tough for me to say if that's going to be like a problem for other patients. You could use it as long as you're using like a gentle cleanser immediately after and washing your face. Let's just say that. Let me know, hopefully that'll be okay for you, but it should be okay, but just I want you to clean up, like if you have makeup on or like sunblock, then you want to clean that off. I'm assuming that's why you're doing it. Otherwise, you really don't need it, actually. I use it because it's almost like my pre-shave type of thing I use. It works really well for me for that purpose, like this oil-based cleanser, and then on top of it, I use like a shaving cream, it works awesome. But I'm not sure, I'm not sure exactly how your skin is. Tony Santana, good seeing you on again, Tony. Tony's saying, hey, Doc, I'm just wondering if I come for my treatment, which includes Subcision, CO2, Erbium, TCA, and Sculptra, and I have a beard. Should I shave off the beard, and will the treatment affect regrowth? The treatment won't affect beards. That's going to be fine. It's a good idea just to shave so I can just make sure I cover everything. Like, why not? You're coming all the way out here. I'll help you and just to cover everything. Sometimes you may be surprised. Sometimes patients are shocked that I discover like a scar that they never even realized, and I'm just like smooth it down anyways. And then later on they're like, oh yeah, I guess that did make a difference. That was like something cool that we just did. So there, you may not even realize. And one day maybe you shave, you think right now you have a beard for the rest of your life, but one day things could change. You don't have a beard, and it's like, why not just keep it really smooth and like everything evened out? Iram is saying, sir, I got a procedure of fat grafting 7 months ago. Now my skin feels loose. My jowls have appeared and my crow's feet are still visible. More after my doctor didn't guide me for aftercare. I'm sorry to hear that. I guess I'm looking for the question there. Was there a particular thing that you're worried about with that there? Daniel saying, are there any treatments of post-inflammatory hypopigmentation? Yes, there are. There are treatments for post-inflammatory hypopigmentation. Actually, I've always been able to recover that pigmentation. It could just take a little bit longer than patients may expect, but there's a lot of different options. Actually, you could do a UV lamp. Actually works very, very well. Tacrolimus actually could work very well as well. A lot of times you just want to start early on, make sure you're doing it early, and a lot of times it could actually activate the melanocytes. It is something that could occur really, really rarely, and usually it is due to some sort of sun damage still that could occur. So sun damage has still occurred, and instead of it causing hyperpigmentation, it could cause loss of pigmentation. But when it comes to more like lasers and energy devices, and it's causing that kind of temporary hypopigmentation, really there's a process where it's going to look like it's blotchy for a little bit of time, and slowly you'll start seeing like over time there's little melanocytes that start waking up, little bits of that. And then over the course of 3-6 months later or so, it starts returning closer to your natural skin tone. It could take, though, even a year sometimes for some patients, though. So I couldn't actually take that long. Hannah's saying, when I win the lottery, I'm coming to you. I hope you don't need the lottery to come to me. I try to keep it really fair for everybody. But I hear you. There's a few different options that we could always do, and there's always lots of different payment plans. So we take like almost everything for a payment plan, to be honest with you, like almost everything. I want it so that like you guys could just do anything. And it's like whatever some of these guys are like crazy with their percentages to us actually, but it's like I just wanted things that you guys just have a bunch of options and choose what things make sense for you. So take a look and see. We have a lot of different options there. We have a lot of different things that you could potentially see in terms of payment options. So, and it comes to just a few, just a little bit per month. Then if you want to stretch that out there. Thank you so much, Dee. Appreciate you. And let's see here. Rai saying, I have a small boxcar on my nose. What's the best for it? A boxcar on the nose could take a lot longer. A lot of times we do actually want to do a little bit of TCA Cross. Sometimes you use a laser around the edges of the scar. And the nose area is an area that works well for something like Bellafill. Just little bits of Bellafill actually could do very well. There's very few people you should go to for that, though. It's really a very difficult area to do it properly, but you could do it. It looks awesome. Veronica is saying, Doc, I'm nervous. I got a rhinophyma. I guess you're saying a CO2 laser coming up. It'll be okay, actually. Surprisingly, it's actually not painful. So it's going to be okay, actually. Darwin's on here saying, can you come to Atlanta? I have a few patients from Atlanta. The thing is, I really appreciate you guys. I really do. I don't take it lightly that all of you guys come all the way over to me. I really, really do appreciate it. I just have to make sure things are done very, very well, very effectively. And that's why I have to stay at my practice over here for that purpose. So my team is here. Everything that I need is over here. So that's why, and we're just 5 minutes away from the airport. But, I appreciate it. I appreciate you, wanting me to come out there. It's just, I need to make sure also that things are just done so well. So I can't just go jump into a clinic. I'm just not that kind of person just to go into a clinic. I just need certain things really structured for myself. I don't stress about the way things are structured in my practice. It's okay, this is the way the trays are. This is the way this is. This is the way this is. And I just don't even have to worry. I'm like an airline pilot. I just no, this is my flow. And my patients know I just have a certain order. My team knows I have a certain order all the way I do things. And so that way I just don't worry about things. Where are you located? Near which airport? We're near John Wayne Airport, SNA, Santa Ana. It looks awesome. It's an awesome airport. You guys should try it, actually. I think it's the best airport in America, to be honest. You'll see. When anybody goes there knows it's the best airport, actually. And then you wonder, why are more airports not like that, actually? How did I get perfect skin? I don't have perfect skin. There's still flaws. Every once in a while, there's a day where I was not great. And it's gosh, that stinks. Because it's I wish I always had perfect skin. There's days that you just don't. And it's sometimes it just happens. It's gosh, I don't know what I did. Everything was right. Everything was there. It's sometimes it just takes a while. Sometimes it's your skin looks it's great. And then sometimes it's not that great. And then it's you just do lasers and energy devices. And eventually it does end up getting where you're really, really happy. So it's it takes a little bit of time. And then also doing low dose of retinoid. Low dose retinoid is awesome. Just do it that way. Just low dose retinoid, low dose tretinoin, consider that. Good seeing you on, Neela. Neela, reach out to us. Actually, we'll be happy to see what else we should do to help out and see what other things we should do to see. I haven't seen you in a while to make sure that those areas where you still had your pigmentation, we'll take a look and see. And let's touch base. I know your last time we spoke, you were saying it was really significantly improved. I know you're saying it's significantly improved now, but let's make sure. And sometimes little edges of the pico laser could help out a ton. So let's talk a bit about tomorrow. If you get a chance to reach out, talk to my team. Otherwise, I'll try to tell them to reach out to you to schedule something there. And but it may it may be at some point we'll try to fit you in just to follow up with you about that. Shake is saying, I got superficial slight depression in the skin after vascular laser on the nose and area. Is it temporary? It may end up being permanent if you don't do something a little bit of subcision underneath there. It may be a little bit there. So you may want to go in there and actually break up that little tiny bit of where the lasers cause a bit of scarring. And that could happen, actually. The laser in the a vascular laser on the nose can sometimes cause scarring. Sometimes if it's a little bit too much energy, it could actually do that. So because there's a bit of a blistering effect that occurs with that. So you may end up needing to do something, a little tiny bit of subcision, potentially even a laser actually to smooth it out. So it's tough to say if it's permanent or not. It may not resolve just on its own though. So maybe you have to do other interventions there. Yalda is saying, Yalda's honest, she's saying, how many days after subcision and microneedling can I go back to tretinoin? I appreciate how fast you talk. Thank you. I try to slow down sometimes, but there was a lot of questions that I wanted to catch up to. So yes, we could do subcision, microneedling. You would do basically usually about 1 week later, you could do retinoids. And I don't know who's doing subcision and microneedling for you, but you just heard me say, I don't think that it's a great option there. Keep It Zen is saying, the whole team is awesome. I love the airport. Awesome. Yeah, that's exactly what I was saying. It's a really, really good airport. It really is. Let's see here. Topaz is saying, can Sculptra be used near the buccal area? I have volume loss from rolling scars and boxcar on my lower cheeks. That part of the face, actually, it's better to use dilute Radiesse or Bellafill. That works a little bit better. Sculptra, in areas where you can move, you get more risk of nodules. So I wouldn't recommend it typically, unless it's a very dilute form. Not everybody knows how to dilute it properly, to be honest with you. So Yalda's saying that the subcision worked out well. Awesome. I'm glad it did work out well. So that's awesome. Just consider then, if it is that in exactly what you're saying, I wouldn't necessarily repeat doing subcision, but you could do, other treatments now, and then consider doing something like a topical retinoid then. Vanilla is saying, what HA filler is best for filling in deep boxcar scars? So usually you want to do a filler that's not cross-linked in the superficial part of the face. So you could do skin boosters. Those are okay. Or like just Restylane Classic is another one that could work out pretty well. You don't want to do things that draw in too much water. So Restylane Classic actually is a good option there. Yanni's asking, do phenol peels really work on acne scars? Yeah, it can work very, very well on the right patient. This patient right here is Fitzpatrick 6, so I would not do it on him. It would cause more hypopigmentation, loss of pigmentation there, and that could potentially, when it comes to phenol, be more permanent. But if it's something else, though, that we're looking at over here with a patient of, let's say, Fitzpatrick 1 through 4, and he had deep, thick scars, very, very thick edges of the scar, then yes, you could consider doing the phenol for that purpose then. So that's something that we could potentially consider there. Neela is asking, will tretinoin or hydroquinone help even out the hyperpigmentation? Yes, it could. We could talk a bit about that to see if we could help out with any pigmentation issues. We never want to have anybody with long-term pigmentation. I know that it's only been a little bit of time for us, but we can still make sure that we get that cleared up for you, Neela. So again, we'll talk again soon, actually, to make sure that we can get that solved for you for pigmentation. Pigmentation, something that really is about balancing a lot of times. We want to make sure that as we're doing anything that lightens up the skin, we definitely want to make sure that we're also using a lot of sunblock during that process, because it could end up overshooting it there. So, we'll walk you through those steps there for you. Bao Kimmy is asking, how many sessions? Good seeing you on, Bao Kimmy. Saw your updated photos, by the way, look awesome. And Bao Kimmy did a treatment about a week ago. Again, our second step looks awesome. And yes, this particular patient was about 2. I got to double check. He comes all the way from St. Louis. So we did 2 sessions actually. And then when he came in this day, we ended up doing another bit of TCA Cross and some more Bellafill. So it's going to look even better. Although last I heard, he's very, very happy on life. And so I don't know if he's going to be doing more treatments. But if he ends up doing more, we'll get better improvement in some of those areas where there's volume loss there. Always Blessed is saying, is it possible to reach perfect skin eventually if you had acne scars, or will it only improve a bit? It's not going to be perfect. It really isn't going to be perfect. It's like, to me, I'm really happy where it's at for my own life. I'm really, really happy. I was not happy for a long, long time with my skin. I thought it was like, sometimes it was fine. A lot of times it felt like it was visible to me. And now it's so close to invisible that it just makes my life a lot easier. I don't have this constant stress that I used to have when the camera was in front of me, or I was looking at myself in the mirror. So I just no longer worry about it. I don't even really think about it. And so it's awesome. That's a really, really good feeling. Is it completely perfect? There's absolutely no way it's completely perfect. I did find, though, that now under even harsher lighting, it's a lot less visible. And it's a lot less visible than it's really close to that perfect thing. And like I said, it's a lot less. It's not that it's completely invisible, but it's a lot less. And here and there, it sometimes bothers me a bit, but it's okay, and it's pretty close for me. Pretty close. And I just accepted that, okay, it was a little bit, it's okay. That's the case, and I'll keep on working out when I have some time, and I could always do things. And I feel like there's if I'm getting older and I find that some more volume loss or so, and it look like I need to do something about that, I'll do it and I'll figure it out and get something solved for it. And it's nice, it's nice to know that. But I do think that you really have to not come into it thinking that you're going to want perfect skin. And you'll be surprised. I mean, I have patients right now today. I had somebody also, I have patients that you see them on TV, you see them, in movies and things like that. And you assume that they have perfect skin, and it's not true. It's just skin ebbs and flows, just like anything else. And there'll be times you may see them and it does seem like it's completely perfect, but they also do have a lot of stress too, because it's expected to always be perfect. So you have this process where people are, looked at as if they're supposed to always have smooth, perfect skin. And then other people may comment on the fact that their skin isn't as perfect at some point. Or they may feel a little bit happy that their skin is not as perfect. Oh, now this guy got knocked down a bit on the pedestal. And they just, that was that was something that they were viewing their self-esteem with, that other people were complimenting their skin or so. So really, you can't focus on that kind of perfection. You can't focus on what other people are going to view it as. You can't think of yourself that like, well, I'm trying to make other people happy for, for my skin. I can't make it so that this is something that, there's a process here where you yourself just have to feel like content, and you just have to have this inner gratitude where it's like you look at yourself that at one point when you're 15, when you're 16, when you're 18, when you're 19, 20 years old, I was like up to 24, 26, where I had bad acne. And I looked at it and it's like, I was like, it was really affected me. And it's like, okay, it's done. It's over. That whole journey's done. And I'm in a place in my life where I'm really grateful for what I've been able to do and get to. And that is a really, really great feeling. And I think that's what we should all try to achieve, like that bit right there, where it's like, at one point things were pretty tough. It was a really difficult thing for people. It was a really difficult journey for a lot of patients. A lot of people will tell me, especially when they're one-on-one with me, they'll talk to me about this, and they'll say that, they really suffer from this. They really suffer from it. And it was like true, like anguish. It was true loneliness. It was truly difficult to move and navigate in a world where it's expected to have perfect skin. And it was really, really difficult for them to accept the fact that what was at one point normal, healthy tissue has now turned into acne and then turned to scars. And it's, extremely frustrating, and it's extremely disappointing and extremely lonely for people. And it's like, that's something that continuously, you hear that theme over and over again. What we're trying to solve is that feeling. We want to have it so that you no longer feel that discomfort. You no longer feel that buzzing sound in your brain where it feels as if there's something external that's affecting you, that like you couldn't achieve the best possible version of yourself. And that's why this whole month I've really been pushing. I told everybody, let's really go through this mental health, because there's a lot of patients, there's a lot of people that were just suffering from so much for so long. And it's like clear that nobody really ever talks about this stuff. And everyone goes on there and they go on social media and act like their skin is perfect or this, or they just use like this like snail mucin thing or whatever else that they were using, and salmon sperm, whatever else. And they're like, oh, this is the thing that solved my acne and this is all you have to do and blah, blah, blah. And it's like, look at my crystal clear skin, look at my like glass skin and how to achieve this glass skin like that. And the reality is that those same people, they have skin that shifts and it changes, and sometimes hormones fluctuate, sometimes things can also happen. And it's now like, you made your entire world around this fact that you're trying to achieve glass skin. Like, be happy with their skin, of course. Like, I want you to achieve really excellent skin, but it's like for yourself. It's for the fact that you were at one point really insecure and you were traumatized because of your skin. That's what we're going to try to fix. We're trying to fix that trauma. That's the thing that we're doing with this. It's not about like this achievement, trying to achieve this perfection. I'm not trying to achieve perfection. I'm not trying to have you achieve perfection. That's why I showcase over and over again these results that showcase there's still acne scars, there's still visible scarring. And this vast majority of people, vast majority of people would be extremely happy, as this patient is, extremely happy with this kind of improvement, extremely happy. There's going to be some people that are just going to think that they just have to have it completely smooth. And it's like, is it possible for us to get better and better results? Yes. But it's like, we'll see what we could do. We'll see how to get there. But it's like, it has to be at a certain place in your mind mentally. What are you doing it for? Are you doing it because like your husband makes fun of you for your acne, your scars? Is it because like, someone else like didn't go on a date with you because of this? Or is it because like you truly just want to, you view this as something that's just holding you back on achieving everything you want to achieve in life? That, if you're ready for that, then this is where we're going to take you. We're going to get it so that we will solve that part of things in your life, and you could just put this whole chapter behind you. And then one day, whatever you're in, whatever field you're doing, you could go back and really try to solve and heal people too. And whatever thing you're doing, I'm not saying you have to go and be a physician, although that's great. I mean, do more things for medicine, but like solve it in your world. Try to leave this world better than where you got it. Just like leave it better. Leave a lasting impact. And you were able to do this because you healed from something like this. This was holding you back. So I would love for that to be the case. I want that to be the case. Look at this story. Excuri is saying, I had CO2 ×2 subcision and skin boosters, and I still got rejected for cabin crew due to the scars. It happened twice with Middle Eastern Airlines, and I'm so sad. That is absolutely terrible. That's a seriously sad, that's a very, very sad story. I'm so sorry look at that story. And that's a story that a lot of patients tell me, like a lot, like they felt like, you know, they were in the service industry or so, and not even just scars, like pigmentation too. I had a patient, she had terrible melasma. She had severe melasma, and she was working in Vegas, and she told me that her coworkers are making fun of her. Who like coworkers are sitting there making, what age are we now? You know, like, this is ridiculous. It wasn't acceptable back in junior high. I don't know how it's acceptable now. And it's like, you know, they're being bullied for their scar, or their skin or their scars. And it's a totally, you know, my own thing though is that I would say though, to be honest with you, Accure, is that it's, first of all, it's terrible that happened, that you were rejected due to your scars with your job. I mean, I think it's terrible by itself. But the truth is that, first of all, whatever job you go into, you can figure out, but you'll do something where there's a solution for your scars. You know, there's things that we could do to make it better. And it's unfair that someone was doing something like that to you that was essentially making you feel like, you know, less than you should be, really. And that's what people don't want to feel. When they have scars, they notice a lot of times. One patient told me so perfectly. He comes on sometimes, actually. I don't know if he's on tonight, but he tells me a lot. He said, I notice a lot of microaggressions against me. He's like, I notice a lot of people have microaggressions. That was a very interesting statement that he said, that there's microaggressions. And it's because what he's noticing is that some people who you're thinking to yourself that you're just talking and you're just having a normal, natural conversation, and they're sort of diminishing what you're saying because of the appearance of your scars. And this particular patient, he had very, very severe, deep scars. He's somebody actually who'd done 6 subcision sessions beforehand. I had to break up that scar tissue very, very effectively. I ended up doing a Phenol peel on him. He's already has an awesome result. 4 weeks out, amazing result already. And it's going to be even better. And it's like, he's an awesome person. He's going to continue to be an awesome person. And those people, really, what I told him is true, is that we really can just like carve those people out of our lives and carve them out of society. It's actually an interesting thing when you actually think of it that way. People who have acne scars, most people in this world who have it and understand it and are listening to these things, most people realize what bullies are. Most people actually do now, because it's, even if you're like somebody who's like, you know, a tall guy, strong guy, you know, and, you know, you do like all sorts of things. Your scars, you may have realized that people were bullying you a bit, or viewing you or judging you a way that you didn't like, or you know, you felt that you just weren't respected the way that you thought that you should have been. And it was like, no matter who it is, and it doesn't matter if you're a person who's like, you know, somebody who otherwise doesn't seem like you'd be bullied. It's possible you felt those microaggressions, which that patient was referring to, microaggressions, and you recognize other bullies. You recognize people who do actually punch down. What they do is, you know, even if they're in positions of power, they're punching below their weight class. You see it because you know what that is. You felt it. You already saw other people do it. You saw people potentially with more acne and more scars in yourself, and you saw how they were being treated, and you saw it. And you were aware of it, and it opened a door for you, and you recognize the fact that there is this process in this world where there are people who truly are just terrible human beings, and they really do actually look at people and try to make it so that if they are a little bit below them, they're going to just keep on beating them down so that they stay below them, and they just want to have it so that, or they view themselves a little bit below them, I should say. And they just want to keep on punching them down, and keep them below. And they never want them to rise up. And there's people out there. There's actually a few people. It's actually not as big of a group as people said. Before I got into this scar world, I'll tell you, everybody, all these doctors, so many people would say, don't do acne scars. Whatever you do, don't do it. They're just the most difficult patients in the world. They'll never be happy, never be satisfied. Just don't do it. And there's a lot of people actually who are doing scars, and they ended up quitting. A lot of people actually that were doing it at a very, very high level, they just stopped doing it because they just got tired of the fact that there's so many people that were just like wearing them down. And there's a lot involved with it. There's no question. But it's really true. Well, I've done so many patients, more patients than anybody else in the world, actually. And it is so extremely unusual for some it's just like the outlier of an outlier for somebody to have a problem, to be a problematic patient or something like that. There's always something that we could figure out, solve, understand. And it's like, it turns out that this concern that people had is probable because they just weren't doing a good job. The physicians weren't doing a good enough job, or, they weren't using the right techniques for their particular patients or so. And maybe that's why all these patients were upset with them and all this other stuff was happening. It turns out that actually the acne scar community is actually a very, very great community. And the people actually are like very, very supportive and very, very, and great with each other. It's a lot better than actually people said. It's a lot better than like, a lot of other communities, I would say, because we recognize where there's actually like, there's people out there that really are punching down, and we could accept that, and we could see that there's like, we're going to actually cut them out of our society. So Accure, I like that you said that, and I appreciate everything you said. Accure is saying, I love this holistic way of treatment, doc. I wish you were in my country. I'm from Chile. Well, I have patients from Latin America too. I'll be happy to help you out. I'll be happy to help everybody out. Actually, if you come over to my office, we could do things remotely. We could manage it really, really properly for you. So just feel free just to go through my page, give me a follow. Go through my page at drqazi.com. You could actually be able to see all of our prices on there too. We'll be happy to help you out and set things up for you so we could do it that way. Hold is saying, hello, Dr. Qazi. I have a deep dent on one side of my cheek. Even after subcision with Radiesse, Bellafill, and Sculptra, it still looks sunken in after shaded sunlight. Was the subcision not done properly? It's possible. We may have to break it up. We may have to break up that scar tissue. So let me know. We will see what we have to do for that. If we need to break it up or what exactly is happening over there, it's possible that that's what you need. All right, guys.